Hello, my name is Ashley London, and I interviewed a nurse named Miss Marquette, who was a current employee at Novant Health Forsyth Medical Center. From the information that I gathered, I created this PowerPoint called Roles and Responsibilities of a Nurse. What inspires nurses? I have found that nurses are inspired and attracted to the profession for their love of people and caring for others. They also find it rewarding as they watch patients gain optimal health. It is also gratifying for them as they watch life enter and leave the world. Nurses are also inspired into the profession as they either have taken care of an extremely ill family member or they have family members who are in the medical field. Why nurses love their profession? The profession of nursing is taking care of people. They find that caring for others is their mission and goal in life. They find that at the end of their shift, they leave feeling joyful and humble as they have made a slight difference in another's life, even though it's for a brief time period. The hardest part about nursing. Nurses have found that the shorting of staff is the demanding part of their job. Nursing has evolved and more nurses have turned towards travel nursing. Due to travel nursing, there are more travel nurses on the floor than there are locals. This is hard as travel nurses are not as familiar with their patients, faculty, and staff, which makes it hard on the local coworkers. A typical good day in a nurse. The typical day of a nurse starts by the nurse receiving her assignment and her report from the previous shift nurse. From there, the nurse will create an organized plan of how she is going to pass out and administer medications and perform treatments that are immediate. From there, after the medications have been passed out and the treatments have been done, the nurse will do a physical assessment on all of her patients. As she is passing out medications and performing physical assessments, they will document what they have done. From there, they will create a plan for the second half of the shift. Throughout the day, nurses will attend patient plan meetings. Nurses will contact physicians and family members and will also perform various treatments. Nurses can get a variety of jobs, and I have chose a few to elaborate on. There are medical surgical unit nurses, oncology unit nurses, intensive care unit nurses, and intravenous teams. A medical surgical unit nurse typically focuses on patient safety, care planning, medications, and procedures, and that is typically in a diverse patient population in an acute care setting. Oncology unit nurse typically focuses on cancer patients, prescribing medications, administering chemotherapies, and caring for not only patients but also their families. An ICU nurse typically takes care of intensive care patients who have been in a critically ill case, such as an injury, life-threatening disease, or have come from surgery. An intravenous team, they typically focus on maintaining drains and tubes, central line care, assessing, and receiving labs. You also have hospice care nurses and hospice home care nurses. Hospice care nurses typically assess the patient's pain and give them medication so that they're not in pain for their last few days of life. And hospice home care nurses make sure that the patient's families are able to help with the patient's care at home and provide medication so that they're comfortable for their last few days of life. The reflection on my interview. After performing the interview, I found myself feeling good and confident about the profession that I'm entering in. I was reassured that nursing is the profession that I want to enter in, as I have a passion for caring for others and helping them obtain good health. I learned that nursing is not only caring for the patient, but also their families. And nurses assess, document, plan, implement, and evaluate a patient so that they can create a journey that will get them to their goals and obtain great health.